Guys, what's up? Welcome back to the channel. It is super gloomy, rainy, windy day here in the Bay Area, but I don't care because today is December 1st, and you know what that means. It's Christmas season! So, super excited about that. For some reason, I'm just really ready to be decorating for Christmas, and I already have my Christmas tree in my room. It's looking super cute. Feeling really cozy, getting into all of the cozy fleece jammies, all that good stuff. Anyway, today's video is going to be super awesome. Before we get started, if you enjoy hand therapy content or you want to be part of this forward therapy community, please go ahead and subscribe to the channel so that you don't miss any hand therapy related content, and go ahead and give us a thumbs up if you enjoy the video today. Speaking of thumbs, that's what we're going to talk about today. See what I did there? Yeah, I'm a little hyper. Had too much coffee this morning. It's cool. So yeah, let's get started. So our thumbs are a very unique finger on the hand, a very unique digit. Obviously, they can do a whole lot of different movements that the other fingers just can't quite do, and they give us a whole lot of function. When we don't have the thumb, it makes it really difficult to function. So, in cases where a thumb has to be amputated or things like that, oftentimes a surgeon will actually transfer a toe or try to save the thumb at all costs because it is such an important functional finger. Today, I don't want to talk about anything too crazy. I just want to show you guys some different movements that the thumb can do and some range of motion exercises that I often give my patients to get the thumb moving and help it stay functional, right? Because we know that if the thumb has all of the available movements and it's moving well and it's functioning well, then you're going to be able to participate in the activities that you want to participate in. So, let's go ahead and get started. These exercises are going to be great for patients with thumb arthritis, right? Like CMC, DJD, or that basal joint arthritis. They're going to be good for people who have had surgery or different, fractures or all those kinds of things, just to get their thumbs moving again. With a thumb, you also want to be careful because I found that patients oftentimes want to kind of crank on their own joints and pull it in different directions, and you just want to be really careful with the thumb. So always teach people to do things gently, correctly, and not pushing the joints past their normal plane of movement, which is true of all the fingers too, right? I mean, we don't want to be cranking our fingers back in crazy directions and putting a ton of pressure onto them that way. So anyway, let's go into the 4 basic exercises or movements that the thumb can do. So the first exercise that I often give people is Radial A Deduction, or extension of the thumb. So if we're looking at the hand in this plane, Radial A Deduction is bringing the thumb away from the palm in line with the index finger. So if I turn my hand this way, you shouldn't be able to see the thumb at all, right? So just kind of take a look at what that looks like, and then adduction is bringing it back in. So Radial A Deduction. Also notice that my thumb is moving from the basal joint, so it's moving in a straight line all the way out. And of course I have a little bit of a hitchhiker's thumb, blah, blah. So that part kind of bends backwards, but I'm not collapsing at that MP joint, right? It's very important to keep the whole thumb moving in a line and not just from the MP joint, right? I can do it better on this side. I have an overstretched MP joint on this side, like my volar plate is overstretched. So what you'll see a lot of times is people will do this movement, right? So the movement in this case is coming from the MP joint, which is not what we want. We want the movement to come from here, from the wrist. So bringing the whole thumb out and then back in. Moving right along, the next movement that I often give people, which sometimes is difficult for them to grasp after you've shown them radial abduction, right? The next exercise is called palmar or horizontal abduction. So that in that movement, you're actually bringing the thumb in line with the index finger first and then pulling it away from the index finger in that direction. Sorry. Wow, that was cool camera work, guys. Bringing it back in. Here, I can show it this way. Wow. Yeah, we're good at these angles. So when you look at the hand in this direction, you will see the thumb because it's coming away from the palm. That's your palmar abduction movement. The next movement that I like to give patients, because it's a functional movement and we need to be able to oppose the thumb or to move it kind of in that rotated oppositional plane for functional abilities. So I like to give them an opposition exercise. It's also really good for coordination. But what you're having them do is touching each fingertip. And we want to focus on the round factor. So you don't want people to kind of reach flat like that, right? We want them to have nice rounded joints. So it should be like a nice little circle. And you can kind of tell if they're doing it correctly because you can tell that the nails are lining up. So if you see them doing it like this, that's not true opposition. You want the nails to be pretty much parallel with each other. And what I try to encourage patients to do too is rather than just touching the thumb that way, I try to have them open each time. So we're really practicing that oppositional movement and helping to strengthen those muscles and get that range of motion going. This can be painful for some people, and of course you want to just kind of modify as needed. Like we don't need this to all the way to the pinky for any functional abilities. So if they can only get to the ring, that's okay. No big deal there. And then the last main thumb exercise that I like to give patients for thumb range of motion is a flexion, or kind of a composite flexion exercise. So I'm going to show you with my left hand here. You want to keep the thumb trying to touch the palm as it goes down. So people will often like kind of get into this weird oppositional movement. You want them to really kind of trace the palm on the way down. So you're going to be bending at the MP joint and at the IP joint, but you're trying to keep it pretty flat to the palm. So again, from the side, bending and opening, from the front, bending and opening, and that's your composite flexion position. Now that might be pretty painful for somebody with acute OA. They're having a flare up of their CMC joint, so just take it with a grain of salt. I don't tend to give my DJD people exercises that are causing them pain, because that's kind of the point of treating them, right? We're trying to slow down the pain, and we want them to always respect that pain, and that's a key point of education for treating arthritis in the hands. But it is a good range of motion exercise. So if they're not having pain with it, and they don't have to go as far as they possibly can, right? Just keep it within like a pain-free range, just to get that flexibility going of the IP and the MP joint as well. I also sometimes will give more functional based exercises, because some people just don't do well with like and 1 and 2, right? Like some of us just don't like to do that kind of exercise, and so you have to be kind of aware of what your patient's motivations are and what they're going to actually do their home program. So for some people, I'll actually give them more functional based like tasks, especially for things like basal joint arthroplasty people, because they're usually painful, right? And so if they're focused on a goal or an activity, sometimes they tend to do better with the range of motion exercises than if we just have them doing kind of these reps of these arbitrary seeming exercises, right? So what I'll often give people to get flexion, I like to give them like a little clicky pen, right? And have them hold on to the pen, and you can have them kind of choke up or down based on where they're at. And then you're just having them try to click the pen. So obviously that's more of an IP flexion, but you can kind of grade it over time, and you can bring it out a little bit further. You can have them really work through that movement. So I'll give them, do 10 clicks of the pen 5 times a day or something like that, and they'll probably really annoy their family members, but that's fine. I like to use, like a deck of cards too, and have them kind of hold the cards and then just trying to swipe or push the cards off the deck. That's also a good exercise. If they're getting more coordinated too, you can of course have them, practice shuffling a deck is like a really good thumb stability exercise. And then for things like opposition, we can really practice that with a lot of different things. I have some dice handy right now, but you can just have them like pick up small objects and put them down, alternating fingers, and that's going to help them practice their opposition, right? So just getting creative with it. You don't necessarily have to give standardized exercises on a handout. Like for some people that works really well and that's what they prefer. But if there are people out there who, do a little bit better with like a goal in mind or like an activity in mind, then by all means go for it. That's what being a occupational therapist and a hand therapist is all about, is just finding the right motivation for your patient so that they can get better, that you can help them get better. So yeah, I hope you guys enjoyed the video today. If you have any questions or comments or exercise ideas, feedback, go ahead and leave a comment below. Again, go ahead and give us a thumbs up if you enjoyed the video, and subscribe if you want to not miss any more hand therapy content from Forward Therapy. Thank you guys so much for watching.